Hi, in this video, I'm going to be talking about intimacy, different types of intimacy, what intimacy is, why breast cancer and its treatment might affect or change your intimacy levels across various facets, and ways you can address changes in intimate relationships. Before I go on, I'd love to have you subscribe to our channel. We put out content 3 times a week, so there's always new stuff to watch. There are really several types of intimacy. We will talk about physical intimacy and sexual intimacy in a moment, but at first I wanted to talk about emotional intimacy, spiritual intimacy, intellectual intimacy, and then sexual or physical intimacy. When we're talking about intimacy, we're talking about closeness, a sense of being seen and being understood and feeling safe and at ease. When we talk about emotional intimacy, we're talking about being able to show up as our true selves, being able to let people see how we're feeling and what we're going through. So if we're happy, being able to share that, and not only the feeling itself, but the underlying reason, what's causing that happiness, that anger, that sadness. And it's important when you're going through anything serious like breast cancer and its treatment to find people with whom you can have that level of intimacy or connection. It may not be your partner, it may not be your best friend, it may not be the people who've been there for you before for various reasons. Next is intellectual intimacy. This is where we have a free exchange of ideas, we share common interests, we're sparked by the same things. And finding somebody with whom you can have intellectual intimacy is a way to keep your brain alive and keep your synapses firing and keep you engaged with the world around you. Spiritual intimacy is when we share values and see the world in a similar way and our place in the world in a similar way. Now, spirituality and religion are not necessarily the same. So one doesn't need to be of the same religion to believe that we are part of something much bigger than ourselves. So that's what I mean by spiritual intimacy. And having somebody with whom you can share that worldview is very important for us, no matter what we're going through. And breast cancer, its diagnosis and treatment can make that all the more important. And then, of course, there's physical intimacy, and a subset of that is sexual intimacy. So physical intimacy is when we can feel safe and close and comfortable with people in our own skin, whether it's being seen without our clothes on, or holding hands, or touching each other in a way that feels meaningful. And then sexual intimacy depends on whether or not we're partnered or not, being connected with our body and the sexual part of ourselves. We are all sexual beings, whether or not we have a partner. When we're talking about sexual intimacy, we're generally talking about being with another person and feeling safe, comfortable, and that we can express ourselves. And similarly, that that person can be that way with us. We generally don't like any of these aspects of ourselves to be one-sided. So if I'm just dumping my emotions on you and you never tell me what you're feeling, there's going to be a feeling of missed intimacy or a mismatch in our desire to be emotionally authentic with people, as one example. So why might breast cancer have an impact on intimacy, our need for intimacy, our ability and willingness to be intimate? Well, the main thing is because you're going through, basically you've had a fracture line in your life story. So your life was going on, if you think of your story like a book, this is something, breast cancer diagnosis or breast cancer scare, even if the biopsy is negative, interrupts the story that you thought you had laid out for you. And that can make different things more salient to you. So let's say you had a big party planned and then you have a car accident, heaven forbid, but you can see how all of a sudden getting to the party and having the tablecloth ironed will not be as important because you've had a major disruption in your trip to your party. The same thing with breast cancer or any other serious illness. This is an interruption in the trajectory or direction of your life. And the things that were important to you may not be important to you now, or they may be more important than ever. And other things may fall away in importance. So finding somebody that can let you be vulnerable and authentic about your feelings without being scared or shutting them down is sometimes a challenge, because people get anxious when someone they love or care for has been diagnosed with a serious illness. So their own emotions can rise up, levels of anxiety and fear and anger, maybe even at you, at the cancer, at the doctor who maybe you didn't pick this up a year ago. Their own emotions can interfere with their ability to hold yours. So you may find that you're looking to different people, and we'll get to that more in a moment. So that's emotional intimacy. And intellectual intimacy, let's say you're used to discussing what you've heard on the radio with your partner at the end of the day or first thing in the morning at work. Those things may not be interesting to you now, or the things that maybe you didn't notice before are suddenly very important to you. And finding somebody who's matched with you on what matters to you in terms of information seeking and what's most important to you in your world and the world around you is important. You may have been incredibly passionate about a global issue, and then you're diagnosed with cancer and your world kind of contracts. And other people who are used to you having a really big world view may not understand the contraction or constriction of what's important to you intellectually. The other thing is you're getting a lot of information thrown at you, and that can decrease the reserve you have to handle other people's emotional and intellectual information. So there are a couple of reasons why it becomes more difficult, or it may just change your emotional and intellectual intimacy. Same with your spiritual intimacy. When we face our mortality, things become very important to us that may not have been earlier. We may notice a lack of spirituality in our lives, or a lack of religious upbringing that makes us feel disconnected from making meaning of this in your entire, how does this fit into your life? And then, of course, the changes that we have in our body can affect our ability to be physically intimate with people. A surgery, the loss of a breast or an incision on the breast and under the arm can make us less physically comfortable in our body. They may change the way we feel about our body, how we perceive its beauty, how we want to be seen by others, or maybe not seen at all. And also, there are other changes that happen with treatment, like sleep disturbances and hot flashes. We may be too warm and then too cold all of a sudden, and being touched may make us uncomfortable. And then, of course, there are some hormonal changes that can happen because of medications we're on, or because we have cessation or stopping of the functioning of our ovaries. All these physical changes don't just affect physical and sexual intimacy, they may affect how self-conscious we are around other people. So let's say you're at work and you're wearing a wig or a scarf because you've lost your hair from chemotherapy, or you've put on some weight. If you feel so self-conscious around people at work about your appearance, you're not going to be fully present when intellectual matters come up, spiritual matters, people's emotional lives are brought up. And again, with your world constricting, you may feel that everybody's looking at you, and they may be, and you may feel they're judging you or evaluating you, which they probably aren't. But people can say foolish things, can't they? I like your wig better than your own hair. Or, there's just, people can be incredibly unskilled in how they respond to us and changes in our appearance. I don't think I need to tell any of you, and it's even before breast cancer, that your body's sort of under scrutiny all the time. And even if it's not in that moment, it may have been 5 minutes before, or it may be again in 10 minutes. I've covered a lot in this video. We've talked about different types of intimacy, why breast cancer and its treatment may impair intimacy, what I'd like to talk about next is how do you manage this need for intimacy and changes in the intimacy you have with different people. The first thing I want to stress is no matter how you're feeling as you watch this video or going about your day-to-day life is correct. Don't let anybody, including me, tell you how to feel. You may actually like the fact that you have more privacy. If you prefer time alone, your level of intimacy after a diagnosis of breast cancer may be just right for you. But if it's not, and let's say you want to navigate changes in intimacy, what are some strategies you can do? The first one is self-awareness, mindful self-awareness of what's going on in your emotional, intellectual, spiritual, and physical life are the first thing. Because if you aren't aware of what's happening, and if you can't pin them down, those thoughts and feelings, pin them down, whether it's on paper or by talking out loud or going for a walk and pinning them down, the signals you'll be sending out to other people in terms of what you need and what you want can be very confused. Now, it's normal to have mixed feelings, and it's okay to have mixed feelings. That's natural. We don't need to think it's this or that. It's really going to be this and that. So, for example, I really would like to open up emotionally about what's going on for me. And right now, I just need some time alone. Or I've been thinking a lot about my place in the universe, and right now, I can't do that. So it's not a this or that, it's a this and that. The same thing with physical touch. I want to feel that I'm beautiful and attractive, and I want to feel like a sexual being. And right now, I'm exhausted and I'm sick to my stomach, and I'd like to not be touched, and please don't leave me. So somebody can be close to us without physical touch. Sometimes I think we fear if we say no to an opportunity for physical intimacy, people will leave us. And knowing what it is that you want and need before you communicate that with other people is so helpful. It can even be, I have no idea what I want and need. This is all new for me. I'm muddled up right now. Just letting people know that can let them know that you just need them to sit with you in your confusion. Confusion is a perfectly normal place to be during all of this. In fact, one doesn't need to have breast cancer to be confused about one's needs and wants. As I mentioned at the beginning of the video, the people with whom we've had intimacy before may surprisingly not be the people for us now, either because it's too much for them to manage or because your needs have changed. You may find that you become quite close with somebody who's been through breast cancer and its treatment, and your usual best friend is not the person you want to talk about with your fears about death, because they say to you, oh, you'll be fine, you're going to be okay. They can't bear that. Whereas somebody else who has faced breast cancer and been through everything you've been through and are going through and will go through, they can say, I understand. It's also important when you're thinking about who can be there for you, to be an intimate partner, whether it's emotional, spiritual, intellectual, or physical, is to think about how your relationship has been thus far. Is it a give and take, or is it one-sided? Have you been able to be authentic with them? You know, I'm careful about the word vulnerable. You'll notice we use the word authentic more than vulnerable. Vulnerable comes from the word to wound. And if you don't feel safe with somebody, it's going to be really hard for you to want to make yourself woundable, basically. But authenticity means what you see is what you get, that the way you're showing up is how you really are. And you may not even want to be authentic with certain people. A lot of my patients have told me they don't feel they can be authentic with their parents, especially their mothers or their sister or another close relative, because those folks get so anxious they just can't bear your emotions. In terms of spiritual and intellectual intimacy, you may find yourself wandering in different circles. You may find that it's helpful to go back to a house of worship. Let's say you haven't been in a while because the kids have been grown up or it's just not your thing. You may find yourself seeking out solace in a small chapel or synagogue, and that's very normal. And also, people who work in houses of worship can be there and be listeners and hold that, though it's usually not two-sided, and that can feel a little funny. They can be there for you so you can explore some of those confused feelings. In terms of intellectual intimacy, finding people who are interested in what you're interested in, you may find you want to be distracted. You may not want to talk about your pathology report morning, noon, and night. You may actually want to be distracted. And a lot of people, when they've been living in distress for a while, really need intellectual stimulation, whether it's reading a book or listening to the news, listening to a podcast, just watching television or a documentary about something else can help you feel part of something bigger and also be a nice distraction. And then in terms of physical intimacy and especially sexual intimacy, the most powerful tool is your words. And even if you've not been used to talking about what you want and need and how you're feeling, what feels good and what doesn't feel good, this is a great time to start. I would love to encourage you to listen or watch the podcast we did with Dr. Sarah McClellan, who talked about physical intimacy and sexual health in people living with cancer. That will be coming out soon. So I've covered a lot. I hope this has been helpful. We love to hear from you. We love your comments, sharing your story. Throw us a question. Although we can't give personal medical advice, we can tell you things that have helped other people. And as always, follow us on Instagram, and don't forget to subscribe to our YouTube channel. We're always putting out new content. Thank you for watching.